In today's episode of Transformation in a Crisis, we'll have Ryan Egnos, an Executive Director at Apex, and he'll be chatting to Dr. Ryan Noach, Chief Executive Officer at Discovery Health.
How are you, Ryan?
Hey, Ryan. Good to be talking to my namesake.
Absolutely. Let's start off with why is Discovery different?
Why is Discovery different? That's an easy question to answer. And I must say that I wake up every morning working for Discovery feeling extremely privileged. It doesn't feel like a job. It feels like a purpose and a meaning. We are a purpose-driven organization. Our purpose is to enhance and protect the lives of our customers. And, for many financial services businesses, that sounds like a very unusual purpose. Many insurance companies would talk about indemnifying customers against risks. Ours is actually to enhance lives, protect lives, and we do that through this shared value model. Shared value is now something that Professor Michael Porter from Harvard University teaches and talks a lot about. But we've been practicing this with our vitality model for many years, since Discovery's inception. And it's really about partnering our customers to improve their lives, and in so doing, creating sustainable profits and products for ourselves, and sharing back whatever dividend emerges, both in financial and lifestyle terms, from the products that we offer, sharing that back with the ecosystem, with society, and with our individual customers so that they benefit even more. I mean, the most simple version of that is by exercising and living a healthy lifestyle and eating healthily through the Vitality program, we are able to reduce your risk of a healthcare incident. Lower risk of a healthcare incident means that our healthcare insurance businesses tend to produce more surplus. More surplus means we can pass the benefit back to healthcare practitioners and incentivize them to keep customers healthy. We can pass the benefit back to the customers in the form of lower premiums. We can pass the benefit back to the ecosystem to create a healthier country and environment for all. And so that's shared value.
These experiences seem integrated into the product and into your brand. How have you built this brand over time?
The brand has almost built itself into a strongly entrepreneurial, innovative brand filled with energy and perceived to be highly disruptive and supportive of society at a broader level. Many of the brand audits that we look at perceive us to be a force for social good and sharing the benefits of the products we create back with customers in a meaningful way. We are seen almost globally as a thought leader in the field of behavioral economics and wellness, and have been recognized by the World Economic Forum for our Vitality Wellness program. I was reading an interview this morning from the CEO of JP Morgan, who was talking about the type of intellectual property that's emerged out of South Africa, and mentioned Discovery as a brand where that intellectual property is globally leading. And so the investment in the brand is one around intellectual leadership, around the shared value, and around pioneering behavior change to ultimately create a better society and sustainable products.
With all that in mind, how has COVID-19 challenged your business, and what lessons has it taught you as the leader of the business?
The lessons are many and the challenge is great. And I think that's the short answer. I think starting with that challenge, at every level of our business, in terms of product, in terms of people, systems, advisory services, business continuity, business redundancy, creativity and imagination, social responsibility, we have been challenged at all of those levels and more. And I think what's extremely satisfying to us as a leadership team is how, firstly, we prioritized our employees and managed to very quickly, through our business continuity planning, continue to deliver brilliant products, brilliant service to our customers, notwithstanding this major disruption to our offices. As a group now, we have more than 8,000 people working from home. And that's been almost seamless, and our service levels have remained outstanding throughout. I think also a highlight for me has been how societally we've played such a relevant role as a thought leader, disseminating reliable factual information, contributing to the environment and the country's response, and certainly leading our industry with new products, new benefits, and new initiatives that we've seen being adopted by competitors and supported by our regulators in the industry. So the challenges have truly been immense. As a business leader, I guess the primary lesson that this has taught us is that black swan events do occur, and that all the risk management thinking, all the preparation for the unlikely worst case scenario is very important, and in our case stood us in very good stead for what we could describe here as a black swan event. I mean, none of us believed that the whole world would land up in lockdown with unprecedented social distancing.
What do you think the future of the healthcare industry looks like? And do you think that new initiatives will come from it, having, when I say it, referring to COVID-19?
Yeah, I mean, this is a tough question to answer, and I don't actually know what the future looks like. We are spending huge amounts of time with our actuarial team building outbreak projections and economic models. So looking at the funding and the economic aspects of the healthcare system and trying to understand what the future healthcare system does look like. This COVID-19 has caused such a disruption to the way healthcare is delivered. At the moment, we're going through a phase during the lockdown here in South Africa where the typical hospital activity that we expect from day to day is literally disappeared. It's at 50% of its usual level. Elective surgical procedures are cancelled. A lot of the medical admissions we'd expect to hospitals have gone away. Many doctor visits have been cancelled. And we wonder how, as we get control of COVID, as the epidemic peaks and then hopefully abates, as we've seen in other countries, how quickly those normal patterns are restored, how quickly we get back to a situation of normal care being delivered for elective requirements, and how the actual delivery of care is materially changed forever. One harks back to when HIV first became a part of our healthcare system. We went through years of learning how to deal with personal protection and hygiene differently in a healthcare setting, how to protect healthcare workers from infection, how to test appropriately at population level, how to educate and screen. It really did change the way we delivered care dramatically. At the time that I was still, a medical student, this is going to have a similar impact. This is going to have dramatic impact to just the day-to-day delivery of care and perhaps even the funding of care. I think one of the really exciting things for me personally that emerges from it, if I have to pick on one area that really excites me, it's very likely that we'll have a much more digitized healthcare system. I think digital healthcare and virtual consultations bring such great opportunity to the healthcare system for a different mode of delivery that may be far more accessible and perhaps even far more efficient for many patients and doctors. And so I think that is one area of great excitement.
I want to focus a little bit more, and in focusing on that, talk a bit about technology, but breaking it up into two parts. You mentioned earlier in our chat about the 8,000 employees that you have working remotely. Can you just give me a little bit of insight into what it is like managing that many people remotely? And also, as a business, were your employees set up with the correct technologies and devices?
It's been an astounding success for us. I think we're all reading lots of anecdotes of big companies having done this quickly and effectively around the world. And I can tell you that in our space, our United Kingdom business, and also here in South Africa, It's been an incredibly efficient process. Within 2 weeks, we got about 8,000 people home. Within Discovery Health, it's about 3,500, fully equipped with workstations configured on our virtual private network, connected to each other through virtual conferencing tools, and with almost no disruption to productivity. In fact, I can tell you that in some areas of our business, we've seen productivity improve, and we've seen that this working from home and this virtual mode is very effective. We do still have in the South African business about 2,000 essential workers who are still traveling into the office. They are largely call center staff, and some of them very skilled call center consultants. And we just found that the virtual call center capability didn't work as well from home, and technically required people to be in our call centers. I think because we moved so many people home, what we could do is ensure really excellent spatial distancing for the essential services staff that remained in the call centers. And so we were able to protect them very well through this process too. So the technology has functioned brilliantly and productivity is up.
As the head of the Discovery Health business, I'd like to ask you a tongue-in-cheek question. Do you have to focus on the mental health of your employees and allow them to switch off from their devices?
You say it's tongue-in-cheek, but it's actually a very intuitive question. I think one of the big challenges that this virtual work brings is the relentless intensity that one experiences working virtually and working from home. Anecdotally, I can talk about my own experience. You feel, because your office is integrated part of your house, you feel like you're always at work. It's very easy to just pop into the office and carry on working. If you don't structure free time, you find yourself working much longer hours than before. There's no commuting and no kind of social interaction walking through the corridors of an office. So all of that time, non-productive time, if you could call it that, is gone out of the day. And so actually you tend to get, in my view, 25 to 30% more done per day. And the mental health impact of that is really material. We haven't seen signs of any mental well-being challenges in our staff yet. We have, I think, conducted a very good communication campaign through daily webinars over a 3-week period, very interesting and engaging webinars with all of our people every single day, lots of engagement and interaction, questionnaires, understanding how they feel. We've addressed many of the hygiene issues as they've arisen. And so we haven't seen any signs of it yet, but we are deeply concerned about it and alive to it. And we have an app-based program called Discovery Healthy Company that allows our employees through an app or through a telephone call in if they need to get amazing psychosocial support from mental health coaches inside our business. And so, we've created platforms and support that I think mitigates these risks, but they are significant risks indeed.
I think moving forward, half the battle will be being alert to these potential threats and putting in place the processes like you have. Sticking with the theme of technology, but switching the focus more onto your consumers, possibly I would like you to elaborate a bit further on the data that you capture as a business, how you use that data, and how you see technology playing an important role in this digital world to connect with your customers.
Yeah, Ryan, we're a data-driven environment. Our founders are actuaries, and everything in our business is steeped in data intelligence and data analytics. At the center of the health business, we've got a big data lake. And through this platform, we converge every data source we can get our hands on. Largely that's split into clinical data, and the clinical data is protected in a vault and may only be accessed on an individual basis if the appropriate consent exists. But then the non-clinical or operational data, is in a separate database, though deeply integrated. And the combination of all these different data points leads us to ask new questions that we thought we never needed to ask. We've plugged these data environments directly into our production systems. And then from the production systems have created digital services and digital front ends for members and doctors who interact with us on a daily basis through these digital front ends. So I can give you lots of examples, but at the simplest level, today that clinical data, for example, is aggregated into a timeline and a meaningful clinical record of care for every member and portrayed to doctors through a digital front end called Health ID, Discovery Health ID. And so any doctor treating a Discovery member can get from us, as long as the member is given the permission and consent to do so, full clinical history of everything to do with that member. Gone are the days of asking about the little yellow pill and the triangular purple pill that somebody's being taken and trying to work out what those are. Our medicine records, our procedure records, investigation records, and so on are really robust and can change the way care is delivered. At the same time, we put those tools into the members' hands and we equip them with very powerful tools, all data-driven, to manage their behavior, their lifestyles, and their engagement with the healthcare system. And, in its simplest form, as you well know, we capture all your activity data, we measure it, we show it back to you, we report it to you, we incentivize you to improve your activity and enhance it, live a healthier lifestyle, we provide you rewards for that. And we've done that through integration with wearable devices, with the Apple Watch specifically, and with a well-used app. So all of these data-based digital sources are really central to our world and will be much more central going forward. The one thing that may be of interest here is that in COVID-19 itself, virtual consultations have proven so vitally important. This allows a patient to consult with a doctor using telemedicine. We built a virtual consultation platform with partners out of Silicon Valley, which we offered to our members and doctors in 2017. The utilization has been chugging along at a very low but consistent rate. We've seen a 30-fold increase in utilization since the COVID-19 lockdown. This is the best way currently for a patient to access their doctor. It's a safe way for a doctor to do a consultation. They're not exposed to a potentially infected patient. Psychologists and psychiatrists can continue to deliver their usual standard of care virtually. And so, these kind of tools become extremely relevant at a time like this.
I loved how you started with you're a data-driven business. I'd like to just ask you, definitely within the context of your business, but possibly if you're feeling brave enough to extend it outside of your industry, do you think that the key to success maybe in this changing world is data-driven insights that can allow you to optimize your business and customer experience?
I think we're living through a data revolution where data is driving process automation, it's driving artificial intelligence, it's driving digital services and channels. And as a result, it's becoming a much faster, more efficient society. There's much more predictive intelligence in a system now. We've developed data models to predict who's next to be diagnosed with diabetes or who's likely to call our call center for service. And so can we reach out to them before they call and answer their question before they even ask it? Or if you do call us for assistance, our data models decide on an affinity matching basis which of our many thousands of consultants would be best placed to provide you the most optimal support and to affinity match you with consultants that are likely to, give you the best service satisfaction and answer your queries. So these examples, I think, just underpin the point for me that I think data is going to inform what any successful service organization or product organization delivers going forward.
I couldn't let you leave without quickly asking you about WhatsApp for Business. How are you employing this technology and what it is doing to help aid your customer experience?
We commenced a WhatsApp for Business service for customer servicing on some of our more digital plans in the Discovery Health Medical Scheme range about a year ago. We've run quite a successful iterative learning program and experiment on those plans, and we've now in the process of opening up WhatsApp for Business to any customer of Discovery Health across the board. We found very high satisfaction levels, and we've had a very good experience with our artificial intelligence virtual assistant, which is working in the background to support the responses to the WhatsApp queries, or for that matter, we can take queries on the web or the app also that are answered by the virtual assistant. It's been an iterative learning journey for us, and it has taken us a couple of years to get this completely right. But now we're finding high satisfaction levels and high availability of the service to customers. So it does seem to be greatly appreciated. And we're very much enjoying having this within our omni-channel offering.
Great. Dr. Ryan Noach, what a pleasure interviewing you. Thank you very much for your time.
Thanks so much, Ryan. Thanks for having me.